Thank you. I'm a cardiologist who actually graduated from this high school and continue to work in this area. Now, one of the first questions out of half my patients' mouths when they walk in the office right now is, what do you think about this bill? They are worried. I had a patient yesterday in the office who's been waiting for a knee replacement for a couple of years. He said, you know what, I got to get it now because I don't think I'm going to be able to get it next year. All right? And so, people are afraid. Physicians are afraid. Physicians are ready to walk. I think the average person in this country has no idea what problems we're headed for with healthcare as it's going now and as you have planned. Your idea of being more efficient is to cut reimbursements to the hospitals and cut reimbursements to the physicians. And as it stands now, over the last 10 years, hospital staffs have been cut down so you don't get the care you got 10 years ago. You still get the therapy. You don't get the tender care that you used to get. And if you've been in the hospital, you know, in the last 10 years, you don't get the back rub at night, you don't get the touchy-feely, it's, oh, let me take care of you, and I'll be on your way. And I know, I work that way. I'm guilty of that same thing. Physicians are thinking of quitting because of what you guys are doing now. You have cardiovascular surgery programs, training programs that are currently unfilled. This used to be the biggest competitive position for residency in the country, and they're unfilled now because they don't want to go into cardiovascular surgery because their reimbursements have been cut so much in the last 15 or 20 years, and because they're doing fewer procedures because we've done such a good job of preventative care for heart surgery. But yet it's still vital. They still need cardiovascular surgeons. They are leaving, all right? And just last week, the Center for Medicare and Medicaid Services has voted to decrease cardiology reimbursements. They basically focused on cardiology services, 21 to 36% on some of the procedures they perform. So some of the people are going to say, do I want to go into cardiology anymore? Because you're dramatically reducing the reimbursement we get on a punitive basis. And you know what they're doing? Cardiology this year. And next year will be orthopedic surgery. And the next year will be oncology. And it's going to go on, and they'll pick out one subspecialty at a time until nobody wants to go to medical school anymore. It's a problem. And you guys speak about unintended consequences. You're hearing about the consequences right now. You can no longer say they're unintended. And instead of speaking about unintended consequences, we want you guys to think about the bills. This is 1/6 of the economy, and you're shoving it down people's throats without any consideration. And you know what? When we send you to Washington, proven to be is have an unsatiable appetite for our tax dollars. Now, if this gentleman is in the 20% tax bracket, he goes to work Monday knowing that he's not working for himself, he's working for the government. So Tuesday morning he wakes up and says, I can work for myself. This gentleman, he's in the 40% tax bracket. He wakes up Tuesday saying, I'm still working for the government, and on Wednesday morning, he can start working for himself. If you continue these tax increases that you want to do for health care, then it's not going to be until Thursday morning that someone wakes up and says, I'm working for myself. Now, your thought that you're offering cheaper rates for insurance is a myth, because those rates are being just simply made up by tax dollars. Now, there can be improvements in the healthcare system. I know that everybody in this room knows that actually, as much as we oppose this bill, you've done a great job, the Democrats have done a great job of raising the issue to a fever pitch. And you know what, there are improvements that can be made. But just the fact that you said a minute ago that the only solution is raising taxes is proof that you are not acting as a responsible fiduciary of our tax dollars. Now, what I have done is I've sent my own health care proposal reform bill to many members of Senate, many members of the House of Representatives. And it's a 3-page outline that says there are ways to save money and save Medicare. And the way you do that is every physician knows that there's inefficiencies of Medicare policies that are wasteful. And you guys are wasting our money. You have no incentive to be efficient. All you want to do is tax more. And let me tell you, there's ways that we can treat congestive heart failure by providing better care focused on changing Medicare reimbursement policies. There are ways that we can deliver more efficient cardiovascular care related to coronary disease by changing Medicare policies. And if we change the policies in those two areas of cardiology alone, 5% tax, 5% savings should save the medical system in this country $10 billion. And that's not even including orthopedic surgery, oncology, every area of medicine. So, and that's not even including this tort reform. You know what? Tort reform is good. It warms my heart to hear people crying tort reform right now. And there are things we can do without caps in reimbursements. There are things we can, the biggest waste is frivolous cases. And there are ways we can solve that if the government is willing to hear that. But you see, my proposal has fallen on deaf ears, but you need the input of the physicians to find efficiencies of healthcare. And if you do that, if you save only $10 billion in cardiology, you should be able to save 60 or 70 billion across the country, across all fields. And let's see efficiency. The government needs to prove that it has earned our trust again before you tax us one more dollar.
There is a tea party at Millennium Park. All the doctors are going to be speaking Saturday at noon at Millennium Park. Please come to hear it from the doctors, not the politicians.
A couple of issues I want to respond to. I agree, and I have said, I've been fighting for this, I've been arguing this, that there are changes to reimbursement policies in the way we reimburse for certain treatments, for certain cases, that can save billions, tens of billions of dollars in Medicare. It will then save money because private insurance will also then be paying in a different way. I agree that that money can be saved in Medicare, and we have to do that, and that's what I'm talking about what I want to see improved. Now, when I talk about taxes, the only time I said the only choice is to raise taxes, when I was talking about Social Security, I said if you're going to give a COLA, an increase in the COLA, the only way to do that is to raise taxes. Where else you can't save the money in Social Security. Social Security is a set amount of money that has been taxed to come in, and there is a rate at which it is set to go out. So if you're going to take more out, the only way to make sure that you're not just running that down more quickly is to raise taxes. That's the only place where I didn't say that the only way everywhere else to do anything and to deal with a deficit is to raise taxes, because I certainly don't agree with that. And I agree not to give it to the bankers either, and I have always opposed giving the money to the bankers. Now, in terms of talking about, well, the doctors are going to get hurt by cutting these payments. CMS said they're going to cut these payments. Well, you have two choices. You either need to make cuts, or you need to raise more money to pay for that. You cannot have it both ways. You cannot say no cuts and say, but don't raise our taxes either. Well, we agree with that. Root out the inefficiency. That's going to be lower money. And I'm not exactly sure. We can talk more about what you were saying with CMS cutting cardiologists. I'm not sure what that was, but I would assume that's not just a random cut. The CMS doesn't just come in and do random cuts. There must be something, but you know better than I do on that one, because that's your area. But we can talk about that. But the efficiencies, I agree 100%, and that's what I need to see more of, so that we can, if we're going to move forward on this. Yes, sir, up there.